Greetings, Doc Rizzo here on Heal the Nation. Today I want to go over posture. I'm sure everyone here at one time their mother said, son or daughter, hold yourself upright, sit up with good posture, sit up straight. There's an innate reason for that, and to some people it might not always be clear because you can get away with sitting with bad posture for a period of time and without pain, and that can be dangerous. So creating good habits early is a very good, important thing to do. In healthcare, we like to use the term proprioceptive neutral, anatomical neutral, sitting up with good posture, with good tone. And you not only need good posture alignment, you need good tone. And we call this static posture. More dynamic than that would be movement, carrying this posture into some form of function. But today I wanted to go over static posture and why it's so important. Well, each of us have seen people that were bow-legged or knock-kneed, and those are two instances that where bad posture can contribute to osteoarthritis, typically of the knees, sometimes of the hips, and possibly even of the lumbar spine and pelvis. So misalignment left unchecked from bad postural dynamics, and those contributors can be also tied to your feet mechanics, dropped arches in your feet. Then once we're standing, these arches collapse, and as they collapse, the knees can bow in or bow out because of various weaknesses, etc., and therefore contribute to early or advanced degeneration of joints. We can see it in terms of poor posture of the neck, forward head posture, a very common dysfunction we see on a regular basis. The cervical spine prefers to sit on like a teeter-totter. It should have equal balance forward and back. But if we have a bias to one side, now we can predispose the cervical disc to advanced degeneration. And we oftentimes see that as a chiropractor, accelerated C5, C6 degeneration of the disc. And it's not uncommon. So there are multiple reasons for good posture. Osteoarthritis and pain is one. Another one is vasculature flow. We don't always think of good alignment with better circulation, but the facts are good alignment is directly and indirectly tied to better blood supply, but better venous return. Directly, I mean through the vasomotor contribution from the sympathetic plexus of the spine. So good alignment can open up the vasomotor system so there's good vasculature flow to the extremities. That's one direct way. We have an indirect way as well. And that indirect way can be in the form of loss of mobility, leading to musculature tightness, which affects ultimately perfusion of tissues and vasculature 2, arterial 2 tissues being affected, and venous return and lymphatic return being affected from end range mobility or stiffness or trigger points, etc. So having adequate mobility throughout the range does assist us with circulation. One that's oftentimes missed is immune health. Posture alignment has immune benefits too. And again, going back to the lymphatic system drains, for instance, the inner ear, which can congest the sinuses, which if left there for a period of time can predispose to possibly earaches, sore throat, tooth infection. I'm not saying there can't be other things in addition to congested lymphatics, but that is clearly one. And chiropractors see this routinely on a routine basis. So addressing movement dysfunction alignment is also related to immune health. Pain and sensory. Misalignment can lead to, of course, pain generation from usually joint receptors, sending messages back and causing pain, symptoms being experienced as pain, and also a loss of sensory data input through, again, this sensory somatic generation back to the central nervous system. One that's also often forgotten is slow and steady deterioration and sometimes even atrophy of the organs in advanced cases, where pinched nerve from prolonged spinal misalignment, and this is even seen in studies, the Windsor studies. Dr. Windsor, a medical doctor from Philadelphia, observed after doing autopsies on these patients who had advanced degeneration of the spine, those areas of advanced degeneration, the corresponding organs atrophied. So when you think of posture alignment, I also want you to think of, you can have slow degradation and slow deterioration of the nervous system, even to the point of not in the terms of not complete loss or dysfunction, but partial dysfunction in terms of even organ or sensory or motor impairment. And we oftentimes see this in our chiropractic office. So maintaining good posture, it's paramount for your health. And this week we discussed it in terms of static posture. At a later date, we're going to progress this with dynamic movement, because carrying this alignment over a period of a distance or in the terms of a function, that's even more challenging. So move well, move often, but make sure you maintain good alignment as you do so. Have a good day until we meet again on Doc Rizzo on Meet the Nation.